Gaming has become another addiction, Dr. Manoj, and I've seen a lot of adolescents falling prey to this gaming industry, and they just can't let go off because then it gets very competitive. Then you want to go to the next level, and now globally there are players who are coming and joining, and they get very competitive about it. How harmful can that be to a child or an adolescent's mental health, and what can parents really do? Because Upasana said the minute you take away and when there is violence, it is a sign of withdrawal symptom.
And I think the initial part which we are discussing is that cyber literacy should happen in the family context. As a young child, parents should educate the child for do's and don'ts for use of technology. As I think if World Health Organization also made some recommendation that how much the technology use should be there for a 6-year-old child and how much the physical activity should be there for a young children. I think that part where parent can play a major role. Second thing, because now gaming has become a mental health condition, and somewhere gaming is itself is a problem, but sometimes gaming is also fulfilling certain psychological needs in the child's behavior also. Because child sometimes need affiliation, because nowadays because there is a restriction of getting connected with others in the offline context, so they get connected with the friends in the gaming platforms. They get a lot of acknowledgement and they get a lot of rewards and other things which they feel very difficult to get in the offline context. So that's why again the role of family become very much important, that if they acknowledge child success, if they engage with the child in more maximum time, most of their needs which they are getting fulfilled in gaming platform will get fulfilled in the family context, and they will not feel a need to spend good amount of time on the gaming platform. Talk to the child. If their convocation doesn't work, seek any mental health professional.
How would you guide parents in terms of not being that strict also with their children? Because at the end of the day, they are also feeling that level of anxiety, and they need to vent their energies out somewhere too.
So that monitoring is important, wherein you see that those signs, wherein you're talking about the irritability is coming from because you're experiencing loneliness. If you're connected to a friend talking, you are ending that call with, a better feeling.
Yeah.
So your strictness and your rules needs to come in if you're able to monitor the use of that technology, what my child is using it for. And I think having a proper guideline for that as a parent is important. Forming that guidelines that this much amount of time you use for this much you use for that. And I think a lot of our digital devices today do have a monitor on how much is being used for what. How much is it that you're using for your education, reading books on your tab? How much you're using for social media? How much you're using for something else? So that monitoring, I think the parents can do, and then have a very, rather than being strict, you can have a very nice style of approaching it forward, that this much for this time, your social media interaction for this time, your educational purpose used for tabs this time, because everything is happening on one device only now.
That's very interesting to note. Dr. Manoj, on a winding note, I would like a lot of youth are tuning in. They're watching what you're saying. They're listening into what you're saying. And I'm sure they're understanding what you're saying as well. What would you like to tell the youth today?
Definitely, they have to be conscious about their uses pattern. I think whether it is for substance use or whether it is for technology use. Second thing, they have to realize that is it affecting my lifestyle? If that is there, that's become second signs for seeking help. Third, whether they can work at individual level, because some children have their resilience, some children have their own coping strategies, and they can work also. So, but in case if they feel that their strategies are not working, so they should discuss with the family context, or nowadays a lot of online platforms helps are coming up from even from government sector or even from public health sectors where confidentiality and they can seek help. We do also get sometimes calls from different state, and the child as young as 17 years send me the mail that my parents doesn't know about my issues, but I want to talk to you. So I think if that sort of, I appreciate that sort of awareness, and I generally get connected to those young children immediately so that I can help them out, whatever their concerns are.
Sometimes they just fear going and talking to a counselor who their parents know, because they think it's going to get leaked. My problems are going to go to my parents, and then there's going to be an issue at home. So that confidentiality becomes very important when you want to go seek counseling for cognitive behavioral therapy, de-addiction, or whatever it is. If you could tell the youth today about how confidential all of this is.
So first things first, I will say that we don't call our The people who come to us, patients, we call them clients. Patient is a
Really?
person who has a disorder, right? So he's a client, is not a patient, right? So the stigma of being a patient of a mental health issue, there it is. So the language is very important. So we call
Very
them as our
interesting.
clients, and they're not our patients at all. And confidentiality is a huge ethical, responsibility that we as counselors, as psychotherapists, mental health professionals need to abide by. And with young kids or with anyone for that matter, these confidentiality has a clause when we know that absolutely everything that you talk stays very confidential here. A lot of parents come up and say, what did they speak? Tell me. I want to know what they were saying. So we tell the parent that you want to know what's going on, you come in the session with us. We'll talk to you with your child in front of us.